I'm Dr. Marissa Baca, a board-certified plastic surgeon at the Straith Clinic.
And I'm Dr. Rita Kafawa, bariatric medicine specialist and founder of Michigan Weight Loss Institute.
And this is A New You by Us Too. So in these segments, we try to give you more information about medical and surgical options for weight loss, how body contouring surgery might come into play after that, and kind of help you along with this whole journey. So today we're going to be talking about complications. So this can be a scary topic, but I think knowledge is power. So the more we know about what potential side effects and complications there are, maybe will help better equip us to trying to prevent some of those things and to work closely with our physicians and surgeons if we recognize the beginnings of something to help kind of catch it and treat it early. So why don't we get started with what are some of the common side effects for some of the weight loss medications?
Side effects really are going to be class dependent, treatment dependent. So the big GLP-1 agonist, they do work via a number of mechanisms. So anytime there's something functioning, there is the possibility of a potential malfunction or a side effect or something to go wrong. So a lot of the side effects really depend on how the drug is doing its job, let's say. So, sure. And then it really, in addition to that, also, some people are more susceptible to side effects.
Sure.
And some aren't. So, we always, to avoid side effects, we always start at the lowest dose of medicine needed to get the job done.
Sure.
So what I don't like sometimes is if you read some of the packaging for like the GLP-1 agonist, for example, one of the common weight loss drugs, Saxenda, it tells you week 1, this dose, week 2, that dose. And it walks you through by week 4 or 5, you need to be at this dose. And patients don't know, but sometimes you really don't need that dose.
Mm-hmm. Doesn't seem like a tailored approach.
It doesn't. No, it's just like, if you're treating blood pressure, a patient may not need 20 milligrams of a drug. 10 milligrams does the trick. They stay at 10 milligrams, and that's the correct dose.
Sure. Not
per week or per necessary adjustment. So a lot of the side effects that I do see sometimes are schedule dependent or dose dependent or what time we're injecting. So it's really good to work with someone who's comfortable prescribing these drugs. I mean, a lot of people prescribe them, but you need to work with a physician who's very comfortable volume-wise with these medications because they're able to troubleshoot side effects.
And they can recognize where maybe it's just that small tweak of changing the time or the frequency or the dosage that can help eliminate it for you.
Exactly. I mean, do we have people that have to come off a certain treatment? Yes. Is that common? Very, very rare. Mm-hmm. But if the benefit, depends, benefit versus risk,
sure.
Always.
Always. And is there a way to kind of identify some of those people who may be more likely to have a side effect or more likely to not tolerate the medication as well?
There is. So, for example, one side effect that we don't hear of, I mean, with the GLP-1 agonist, we hear a lot about gastrointestinal side effects.
Yes,
so
definitely.
Nausea, vomiting, and gastroparesis and things like that. But one very common and important side effect that we need to discuss is loss of muscle tissue. Mm-hmm. So these are very strong agents. They will work on a number of different body sites and tissues. So you really need to protect your muscle mass while on these agents, and you really need to work with someone who's comfortable screening muscle mass and has body composition analysis machines in the office to monitor for that. A group of patients that is especially susceptible to rapid loss of muscle tissue is men with testosterone deficiencies.
Okay.
So in this case, I mean, it really is very dangerous to lose weight rapidly and lose. I mean, I've seen really rapid muscle loss, like 20 pounds of muscle. Hey, how are you going to grow that? I mean, that's really difficult to grow. So, and patients don't know about that. So that's one side effect that we do try to counteract. Sometimes it's with exercise with adding a protein supplement or modifying the amount of protein dietary that they're getting to avoid that. And then also just screening, body composition, dose adjustments, and all that.
So I imagine it's important to have an experienced provider like yourself who knows what to look out for and can kind of pick up on that or catch something like that early or ahead of time.
Yeah, certainly. If I have a patient with that medical history of a certain hormonal deficiency or testosterone specifically that we're talking about, maybe we need to tailor his therapy, avoid certain medication classes that carry more of a risk for muscle loss, certainly.
Yeah, that makes sense. And so another side effect that I've heard about is hair loss with some of these medications.
Yeah, so hair loss is certainly a complication that we do see sometimes, and it's not necessarily as a result of using the medication, more weight loss in general.
Sure.
Now, that can happen with severe caloric restriction, that can happen using medications, that can happen with bariatric surgery as well. Anytime we're shifting our weight substantially, maybe rapidly, and it's affecting our nutrients, our protein, our vitamins, there is the possibility for hair loss. So we do offer a number of services to help regenerate hair loss, but most of my focus is on slowing down hair loss and intervening early.
Sure.
So, if it's an iron deficiency, if it's a certain vitamin deficiency, I see a lot of protein deficiencies.
Sure. Catching that underlying reason.
Catching the underlying reason. And we do have the occasional patient where all their panels come back good and they're still losing hair. And they're very distressed about this. So in those cases, we do have to look at regenerating. So we do have a number of services that we do offer to counteract that. And I think it's important anytime you're treating a certain issue, you have to be able to troubleshoot
Definitely.
things that could go wrong. So
definitely. You want to look at minimizing complications, but it's medicine, it's surgery. It is not an exact science, and side effects and complications do come up, and so you want to be able to recognize them early and be able to intervene early, because that's usually makes it a smaller problem than if it's allowed to kind of go down the road and continue and
definitely. And then, with these medications, there's always the question about hypoglycemia. With the GLP-1 agonist, patients do worry about that. Without the use of insulin and sulfonylureas, based on the studies we have, these medications alone should not cause hypoglycemia. The only time I've seen it is when their appetite is so severely restricted that is just what we call low PO intake, low oral intake. That can cause maybe some degree of hypoglycemia. But I do want to reassure our viewers and listeners that specifically hypoglycemia with these agents alone should not be a concern. Now, if they are being combined with other medications for treatment of diabetes per se, there has to be some adjustments there.
Sure. So that kind of gets back to the importance of having a healthcare professional who is experienced in the medications and also knows your health history.
Absolutely.
Knows that you have diabetes and you're also on diabetes medications and where they can interact.
And I'm comfortable making a lot of adjustments, and sometimes we do also work closely with the patient's primary care physician, their endocrinologist, and whoever has been following the patient for some time, years, so they know their case.
Definitely.
Yeah,
a team approach is always beneficial when we can make that happen. That's awesome.
Certainly.
That's awesome.
Gastrointestinal side effects, those are, we do hear about them. There are some patients that can't use certain medications. So, if they have very severe gastroparesis from longstanding diabetes or other reasons, if there is personal or family history of medullary thyroid cancer, really we stay away from the GLP-1 agonist. And that's very specific to Mantoux syndrome and medullary thyroid cancer, not papillary thyroid cancer, not follicular thyroid cancer. These medications work on a specific cell within the thyroid, so not thyroid cancer in general.
Yeah.
It's specific that it has to be medullary or Mentou syndrome. So the data is pretty clear about that so far.
So yeah, a wealth of knowledge and clearly an experienced provider in these weight loss medications. And that's the kind of person you want treating you and helping you through this journey, is someone who knows what to look out for and keep you safe. Above all else, keep you safe.
Absolutely. And maybe you can walk us through surgical complications as well.
Absolutely. We always hope, and my goal for every patient is that we sail through the recovery smooth and we don't have any issues. And in general, success rates are very high, but complications do occasionally pop up. As part of the consultation, I usually like to discuss with my patients what some of the common and even some of the uncommon complications are, so that they know what could potentially be on the horizon. But I think most importantly is letting them know that I'm here with them for the duration of this journey. So if things pop up, we work together to resolve them. Some of the common things after body contouring surgery, fluid collections. So things like seromas and hematomas. So we're always going to have swelling within our tissues. The problem is when the swelling wants to collect into a little pocket, and that's what we call a seroma. And if that pocket of fluid is blood instead, that's a hematoma. And so sometimes that requires, in-office drainage, sometimes rarely, but is possible, maybe requires going back to the operating room. But recognition of those things is key. And so I always think, if you think that something's off, contact your surgeon so that they can kind of walk you through it, evaluate what feels normal, what shouldn't be happening, and look at that. Infection is something that sometimes happens, and sometimes that's as simple as taking oral antibiotics can sometimes resolve that. But again, kind of contacting your surgeon when you start to see things that look off or don't follow the trend. I tell patients, after surgery, slowly, things start to get better, less swollen, less sore. If you feel like there's a change in that progression, now it's getting a little bit more sore again, it's getting a little bit more tender. And sometimes there are reasons for that. Maybe we're increasing activity because we feel better. But when things seem outside the trend, contact your surgeon so that we can help kind of troubleshoot what might be happening. Wound healing issues are pretty rare. A common one is what we call a spitting suture, which so a lot of us surgeons use dissolvable stitches, but sometimes your body doesn't dissolve them well, and maybe a stitch here or there is challenging for your body to dissolve, so instead it pushes it to the surface like it might push a splinter up. And then we see a little opening along the incision line, and your body's just kind of saying, no, thank you to that stitch. Those are little things, common things that a little bit of ointment will fix. A bigger wound healing issue is much more rare, and that's what gets a little bit back to the maintenance and preparation and prevention. So the biggest thing you can do for yourself is not smoke, not use nicotine products. That's probably one of the biggest things that can contribute to some of those wound healing things. Another aspect of it is your glucose management. So patients who are diabetic, I want to know that they have a recent hemoglobin A1C that's low, because if it's high, we know that their glucose is not being well managed and they're going to potentially have wound healing complications as well. So if we can optimize all those factors as much before surgery, it's going to kind of set you up for the best possible situation. Early intervention is usually the key to minimizing a lot of these complications, making the treatment course a lot shorter. So I never want my patients to be afraid to call me. Call me so that we can kind of talk through it, we can go through it. And sometimes we discuss it and it's, yes, this is all normal healing, don't worry, but let me know if something changes. And sometimes we intervene, so it just kind of depends.
Now, maybe we can touch base briefly on revisional surgery and your experience with revisional cases. And
Definitely. Again, the goal with every surgery is, in one surgery, let's completely create the beautiful aesthetic look that you're hoping for. But sometimes maybe we don't have the best wound healing or scar healing. Maybe we have a more prominent scar. Maybe, we got things nice and flat, but there's still a little bit of tissue laxity or a little bit of excess fatty prominence or whatnot. And then that's a situation where perhaps we can go back in and do a little surgical tweak just to make that result that much better. Usually we're waiting 6 months, 12 months or longer before talking about some of those revisions, because we really want to see the body in its kind of final result. Because when you're going through the healing phase, when you're going through with residual swelling still present, it kind of obscures things, and we can't really see what the underlying problem or lack thereof may be. So kind of waiting till the appropriate time to intervene is key, but having an open and honest discussion with your surgeon about what you love, but maybe also things that still bother you, so that I can kind of look at it, evaluate it, and see based on your anatomy if there's something that I think I can make better. Sometimes we have inherent asymmetries in our bony skeleton, in the way we stand, in our posture, and that kind of shows through with some of the body contouring. And that's something that I can't change surgically speaking, but sometimes there are things I can change surgically speaking. For example, a lot of our massive weight loss patients, their skin does not have the elastin and collagen that it once did before the weight fluctuations. And where that can translate to a surgical result is sometimes after we're doing some sort of skin excision, body tightening, maybe 3 to 6 months down the road, they develop some of that residual skin laxity. Because we've cut out that skin, we've tightened things up as much as safely possible, but that remaining skin just doesn't have the good quality it once did. It doesn't have that elastin and collagen to support, so it relaxes a little bit. And so then maybe we have some recurrence of skin laxity. And sometimes that's something that we can do another quick little tighten up again. Sometimes we've kind of achieved what I think the optimal result will be. So communication is key.
And you've always been very straightforward with my patients, and that's some feedback that I do get back. So thank you for that.
Yeah, absolutely, absolutely. My goal is for them to be happy and love the body that they're in. And I think that having that open, honest conversation is the best way to make it known what is possible and what is not, so that we kind of go through that journey together.
Now, briefly, do you offer second opinion consultations from, a patient that maybe has had surgery in the past by a different surgeon? Either they're relocated or they're not 100% happy with their results. Maybe they don't want to go back to their original surgeon. Is that a service that's offered at the Straight Clinic?
Sure. I will always see a patient who has, a question about what's going on. And similarly, I would encourage my patients, even people who are still in the initial kind of information gathering stage, see a couple different consultations, see a couple different plastic surgeons, because not every plastic surgeon's approach to a particular problem is going to be the same. And it doesn't necessarily mean that one approach is right or wrong. We just go about things differently sometimes. And so part of it has to be what meshes well with you as a patient, what surgeon do you feel like can kind of hear your goals and outlook, and you feel like you can communicate with them. Because if you cannot communicate with your surgeon, then it's going to be a difficult process.
Right. We do talk about complications more to be thorough and educate the viewers. But really, like you said, we have a lot of very successful cases, a lot of happy patients. So
For sure. The success rate is high, but I think knowing what could be out there helps also take away some of the fear of it as well.
Absolutely.
Excellent. Well, I hope you enjoyed hearing more about what some of the side effects and complications can be from some of these medications or surgical techniques. And if you have any other questions, as always, reach out to us and look to our social media channels and our websites for more information and past episodes. Thank you so much.